Welcome back to the Oral Health Podcast. This is part 2 of our World Cancer Day series. Now we're going to hear from Emma Riley and Stacey from the Oral Health Foundation. Emma has lots of experience caring for people in end-of-life stages and doing palliative care with different cancer patients and helping them take care of their oral health in the last few days of life. She's got some really, really interesting stories, and I hope that you enjoy.
Hello and welcome to the Oral Health Podcast. My name is Stacey and I'm here with Emma. Emma, could you tell us a bit about yourself, please?
Hi Stacey, thanks for inviting me on this podcast today. My name is Emma Riley. I am the patron of the Society of British Dental Nurses. I'm an ambassador for the Mouth Cancer Foundation and I like mouths. I've started running, Stacey, actually. So funnily enough, we are I couldn't run a K before the pandemic. So I've joined a running group and we're actually looking to do a run between the 3 hospices up here to raise awareness on oral care and everything. So that's coming this year, hopefully. So yeah, I'm a runner.
That's amazing. So what made you decide to go into dental nursing in the first place?
It's not really interesting, really, Stacey, but I was one of them really lucky people that left school knowing what I wanted to do. My mum was a dental nurse, and she I looked at it and thought, I can do that. And I always mention saying that the actual careers advisor at the time told me, don't do that. It's not very well paid. It's not very fulfilling. But that didn't put me off. I was really lucky that I knew what I wanted to do. I should also say that I got into it at 15 and I'm not the best dental nurse in the world. If you ask anybody who worked with me, they'll probably tell you the same. I'm enthusiastic, but I wasn't technically the best, but I knew I wanted to do something within oral care. Didn't want to be a hygienist, didn't want to take it any higher than that, but knew that was the role that I wanted to do, working within dentistry. And yeah, that's what I did. I made as a good of a job as I could do without setting the world alight, but loving it.
Have you ever had any patients whose story has really stuck with you while you've been doing it? Because you seem to have really enjoyed it. So maybe you've made some great impacts through that?
I mean, from doing it from 15 to the age of, what am I now this year? I'm 53 this year. I think our patients, every one of them, leave a mark on you. Just rebuilding people's mouths and making them being able to smile again is absolutely phenomenal. I think this area of the human body doesn't get the recognition that it deserves. And we throw so much at it every day. We just expect it to be there and do its job. So when you do lose a tooth, or you crack a filling, or you get an ulcer that's been a little bit cheeky and a little bit naughty, it does affect your mouth. But I think the one patient who has touched me, as was one of my last patients within the Pennine Acute Trust where I used to work, and the family won't mind me saying it, his name was Roger. I still speak about him today. We wrote an article for Community Nursing about Roger, and it was his story with mouth cancer. And unfortunately, he did pass from mouth cancer, but he gave it a really good fight. And he still is with me today. And I actually think the talks that we do mentioning Roger's, we call it Roger's story, still is saving lives, because it highlights that condition. But yeah, he's the one who can still get me a little bit tearful, even many years later.
Yes. I'm very sorry to hear about that. And you have mentioned like how ulcers can be a little bit cheeky. And it's very, very easy to just put them off and just say, oh, it's only been there a week, but obviously if they go on for a longer period of time, you do want to get them checked out, because it can be a symptom of mouth cancer. What would you say are the other things to look out for that you've noticed during your career?
Within my career, and I must stress, I was nearly going to say I was only a dental nurse, but can I just say that we are the biggest DCP group, and we are really important as far as highlighting the causes of mouth cancer and the things to keep your eye on. And we might come across somebody who something's not quite right in there. And I would always say to anybody, it's if you've got any changes in your mouth that feel different to you, The human body is a fantastic thing, and if there's something wasn't right anywhere else on the body, we would get in touch with the doctor or whoever. Our eye, if we had something that didn't feel quite correct in our eye, we are straight to get it looked at because it's impacting on our health, it's stopping us doing things. With the oral cavity, with the mouth, that tends to be something that we put off. Oh, it'll be okay. And we often find it's not till it's really, really bad that people go and get it looked at. We have got issues with dentists and people being able to get hold of dentists, but I would say to anybody, even your GP can have a look. Something does not feel right to you. You know your mouth better than anybody. We only as healthcare professionals might look in it twice a year, once a year sometimes. Have a look in your mouth. Give it a check like you would anywhere else on the human body. And if something doesn't feel right to you, we'd rather know about it.
Yes, absolutely. I mean, I suppose you could even maybe ask a close family member as
Absolutely.
well to have a look in your mouth, because I think part of the reason, particularly from some of the stuff that I tend to look at, is mouth cancer can be so deadly to people because it's so often diagnosed in later stages. I suppose you might know about some of that during your work.
I worked within I'll give them a plug, the Max Facts department at North Manchester General. Hello, girls and boys. The earlier we get it, the earlier we see. Well, hopefully, like any other cancer. Let's say it's cancer's a cancer, but if we can find it at any time, the earlier we find it, the better. We've come through the last 3 years. I heard it on the news recently. We're 3 years from the pandemic, aren't we? From the start of the pandemic. I mean, where has that time gone? And it's about, and we also know that referrals for mouth cancers have really dipped. So there's a worrying time there, but we need to find them earlier. And I'm dealing with a group at the moment who we've seen a few cases of it recently in the elderly, and they are a group. Mouth cancer doesn't go, I'm not going to visit you, I'm going to visit you, it does not discriminate. And we have got a couple within an area I work at the moment of elderly with dementia with mouth cancers. And you can imagine that is very, very challenging. So what we're advising the staff to do there is, if there's any subtle changes, Stacey, that maybe they're pointing, picking at the mouth, or they're not eating the same way. So what we say to them is, we're observing, look, listen and observe to see if there's been any changes. So yeah, you can have somebody, what do you think this looks like? Does this look right to you? Like that. But with the elderly, obviously, we're finding that quite challenging at the moment.
I suppose that must be very, very hard for a family member or a carer, if there happen to be a care home, to actually look after the person and tend to their oral health if they've got any sort of stuff like that going on. I don't suppose you've got any tips or anything you could maybe.
Big shout out for all the care workers who are working in the residential homes as well, because we are trying to, there's many projects across England at the moment of dental staff or oral health educators going in and educating the care staff on how to manage oral care. I personally think, not just because I work within this area, performing oral care on a patient, on an individual, a resident, is the hardest place to clean in the human. It is hard to do. A lot of the time, they generally don't want you to do it. And these staff are the heroes, these healthcare workers in residential homes. So when we're training with them, we go through approach, how to look in the mouth. We look in the mouth differently because we're dentally trained and we're used to doing it. I had to train years just to know the anatomy of the mouth. We're expecting these staff members just to know what they're looking at and be able to do it. So it's starting from the beginning, talking them through it. But for their residents, just noticing if anything is changing with them. Try and get those dentures out. We found one recently hiding underneath the denture because it's the old adage, they've got false teeth. We don't really need to do anything, but as you know, it's the soft tissues in the mouth we need to be looking at. A loose tooth that's just fallen out, pain, unexplained pain, without trying to overcook it, if you understand my meaning, Stacey, without trying to make it too, but we should be doing a mouth assessment on everybody within our care if we can.
Absolutely, yeah. It's so hard to do it in a setting like that, and it's amazing that they're able to do what they actually do. I suppose, especially with dentures as well, you know, especially if it's like full on, they have no teeth?
My passion is obviously a lot of my work is with cancers, and my age of state, not just with mouth cancer. All treatments, some treatments of cancer can affect the oral cavity, and I deal a lot with palliative care and end of life. But it's not just cancers that can affect your mouth. The mouth mirrors your general health. In your mouth can see how you feel, if you're anemic, if you TB shows itself in the mouth. So it is noticing those little changes.
Yeah, I would just wanted to pick up on that end of life care. How would that differ, like, say, from your average person? Like, what would you perhaps need to do, or maybe keep an eye on a bit more?
So we do I mentioned my passion is within palliative care, end of life and last days of life. So just to clear up, palliative care means we can't cure you. So that can mean they have these symptoms for quite a long time before they enter the other phases in their life. I mean, people have heard me say before, we're all palliative. You know, at some point we're all going to, and it's not a very nice thing to talk about, but I personally think that the end of life should be not celebrated, but should be treated with the same care as birth is. And the mouth goes on that journey. And what we tend to do is dry up the secretions. So we'll put them on medication to dry up their secretions, especially on the chest. So that will mean the mouth gets very, very dry. And when the mouth gets dry, that can then lead to, like you were saying, thrush, pain. The lips can become extremely dry and cracked and can bleed. So what we do encourage the staff to do is to get an oral lubricant prescribed, so that they can apply the gel, to the lips and inside the mouth. We hopefully, if they've got family members with them, we encourage them, we show them how to do that, because often that can be the last thing that they can do before that person dies. And you know, the hospices do tend to inherit a lot of these patients with their mouths very, very dry, with what we call crusty plugs. Some people listening might relate to this, that they have crusty plugs, and without, you know, a lot of people do actually pass with their mouths open. So sometimes it can be quite distressing for the relative to look in and see how dry and crusty. We can't cure it, Stacey. It can get, you know, it can be very, very, very dry, but we can work with it. So I'd encourage people to maybe speak to the prescriber or the GP and getting an oral lubricant prescribed. It's only a little bit of gel that they can apply around the mouth, and often that is the last thing they can do. If they do want their teeth brushing, I always use a non-foaming toothpaste. So I can use it on a dry brush, because the last thing that I need is sit in the muck to try and spit it out. You're just wanting to help them pass in a loving way, that you're not spending too much time brushing their teeth, I suppose, towards the end of life, when we're saying last days. So just keeping the mouth hydrated and lubricated is the main, and letting them able to kiss their relatives goodbye.
Yes.
If those lips are too crusty, they won't. And I always say that's what makes us human, that we do want to kiss that person goodbye. And it is very powerful.
Yes. I mean, the thing you always want is, if someone has to go, is to go with respect and dignity. And I think that's one of the best ways we can actually help someone to do that. I had no idea about that dry mouth at the end of the thing. I must admit, that's really intrigued me.
We're getting dry mouth talking now, because we do. And I should mention, over the last 3 years, we've all got dry mouths because we're wearing masks. So our mouths have changed quite a bit. But the medication we tend to put them on will dry their mouth. But because they're going through that final stage, their mouth does get dry anyway.
Yes.
And it's not really picked up as a big issue until it becomes a big issue at the end.
See, I'd always associate dry mouth with primarily oral cancer, just because anything around like this area, you can't really see where I'm pointing at probably on the podcast when we do finally get to it, but I'm pointing to like from like my nose down to about my collarbone, and it'll affect the salivary glands if you do have anything on it. And I suppose I know some people still to this day having a very dry mouth. It can be such a challenge directing oral care to different groups and their different needs. I suppose one of the other ways we could do it is with maybe like a soft toothbrush. Would that also help?
It does. We use I insist on using a toothbrush that was actually designed by Adam Brooks, speech and language therapist, which is a small head, a baby head on a longer handle. So a nice soft brush, a non-foaming toothpaste, and the lubricant. And I think you've really raised a really. I know I gravitate to mouth cancer sufferers, but chemotherapy can affect your saliva. And that can be somebody with breast cancer, somebody who's had other forms of cancer. I'm on thyroxine. It gives me a dry mouth. So we will have people who are on multiple medications that will give them a dry mouth, remembering that will affect their teeth as well. So the last thing that they need is toothache. The last thing that they need is to have to go, in that palliative phase. I talked to you about the 3 phases. We want to keep their teeth healthy. We know the struggle that our head and neck patients have with their teeth after, when I say we've attacked them with therapy, but they're left with quite a bit of work that needs doing, and that legacy is left with them throughout their lives. Do they get the amount of support? Probably. That's a different that's a different talk, isn't it? The dental support they get moving forward, because it's a lifelong problem that they encounter. But we are seeing patients who've had chemotherapy that their teeth have been suffering after breast cancer for many, many years afterwards. Saliva keeps your mouth lubricated. It's got the enzymes that we need in. It does a job. So if it's removed, the mouth does suffer.
Yes. You mentioned there about support. Do you know if there is any support out there they can maybe access, or maybe even any resources they could look at?
There's obviously the Oral Health Foundation resources.
Sorry,
yeah, I've got to plug you. I'm an ambassador for the Mouth Cancer Foundation. Please, anybody can have a look on there. Macmillan have got many, many resources for staff members who are dealing with anybody with cancer. I'd point you in the direction of the EUCOMIC guidelines. They are absolutely brilliant. They will give you some advice on what to do with patients who are undergoing cancer therapy, because some of them get a very sore mouth, Stacey, as well. So there's things that we can help with that. But there are resources out there that people can access and just give simple advice. The mouth needs to be kept clean and lubricated and hydrated. Those are the 3 things we need for a healthy mouth.
You used to work alongside Macmillan.
So my role within the Pennine Acute Hospital, I was the Macmillan oral health practitioner. I'm sure it was the only role of its kind in the country. So Macmillan adopted me to be an oral health advocate, with my little cape on, saying let's promote oral health. Since I moved away from Pennine, we are trying to get other dental professionals adopted by Macmillan, because I always think that we have Macmillan professionals for everything. Why haven't we got them for the dental profession as well? So I still work alongside the hospices, advising hospices on oral care. So I'm still carrying on with that, writing articles and resources for it. So yeah, I'm still involved heavily especially with palliative end of life groups.
Is there anything else you would like to say? Any final pearls of wisdom?
I think watch your mouth. I think that's probably the last thing I'd say. I think my passion comes across. I hope it does for this topic, because it is so important. And if we had a lesion anywhere on our body, like I said to you before, we'd get it checked out. If we had a major operation on our leg or our arm, we would be told to rest it. We would have physio. We would be slowly back into it. When anything's done to the mouth, the next day you've got to crack on. You've got to eat, you've got to drink, you've got to speak. I just don't think it gets the attention and that it deserves a lot of the time. It is a fantastic area of the body, and also impacts on everything: nutrition, hydration, us as people. So yeah, have a look in, please, within your any dental staff out there, please, encourage people to look in their mouths, even the ones who've not got their own teeth. And watch this space for anything we're doing within residential homes, because I think that is going to be quite an area that needs support out there where this is concerned.
Yes, I mean, there's just so many side effects of mouth cancer that we might not even register in our minds as to what could maybe entail for us further down the line.
You're bearing in mind that, a few of my patients at Pennine had total glossectomies, had their tongues removed, and you can't even begin to put yourselves in the shoes of people who've had that done, and then to change their lifestyle and have to deal with that moving forward. I've done a poem for the Society of British Dental Nurses on mouth cancer, and I'll send it to you. And I've called it the Unwanted Visitor, and there is a paragraph in it that says, "I will be there every time you kiss your wife or your partner. You'll be thinking of me. Every time you have a meal, you'll be thinking of me. Every time you try that red wine, you'll be thinking of me. I never go away." And I think that is what it does, because it's so personal. I think mouth cancer affects the soul of the person as well. So the earlier we can catch this disease, the better.
Yeah, it's got such a psychological impact on so many people. And as you said previously, this does not discriminate. It can strike at any age. In fact, a little while ago in the news, we had a lovely young lady actually who was 25, I believe, when she first got mouth ulcers, and she thought it was because she was stressed. Yeah. And dentist agreed. She was like, you look far too young. But eventually got a biopsy done, and when she was about 26, discovered she had mouth cancer. I mean, you cannot just go, this mouth cancer sits in this box. It can happen to anyone. So definitely have it checked out.
I think that's one thing we have learned over the years, because I'm everybody can see me, I'm bobbing on a bit age-wise, but when I first started, and it still is this group, we still have to watch smoking and drinking as the major contributing factors to mouth cancer. But there was a certain group that who seemed to have mouth cancer. They were the high risk groups. It does not discriminate at all. So you're talking somebody very, very young, in my eyes, and then we're talking a 90-year-old who we've lost recently with a fungating tumour. No, by the way, no risk factors, nothing, this lady, and it does not discriminate. So don't think for 1 minute it won't. But we check our breasts, we check other areas of our body. We should get to know your own mouth, I think, is what I would advise anybody to do. Know the inside. Nobody knows your mouth better than you.
Just before we end, is there anything else you'd like to put out?
No,
or
just
anything?
Thank you. No? Yeah, no, thank you so much. Have a look on your website for all your resources, and especially the Mouth Cancer Foundation. And if anybody wants to get in touch with it about care homes, wants to join the Mouth Cancer Foundation on how we're trying to tackle the care home issue. When I say care homes, remember, care homes are for anybody over the age of 60. And I'm 53. The elderly groups are over 60s in these care homes. So I think sometimes we think of people in their 80s and 90s being in care homes, but I'm 7 years off that. So I think we need to look at this particular group, and there are people with dementia who are getting dementia a lot younger. So if anybody wants to get in touch, I'll send you those articles and the poem. It's not a very good poem, Stacey, but I like it. So you can, I should also mention the Swallows charity. I'm so sorry I forgot the Swallows charity. Give them a shout out, because Chris is doing fantastic work with them as well.
Brilliant. Thank you very much.
Oh, thanks for having me. Enjoyed that.
Thanks for being on.
So remember, for more information about oral health and cancer, you can go to dentalhealth.org, as well as we will link all of the resources that Emma mentioned in the description below. You can follow us on social media at dentalhealth.org, or on Instagram we are at Oral Health Foundation, or Dental Health Org on all the other things. Thank you, and come back next week.